blood-borne viruses. These are also called as blood-borne viruses. So these are also viruses which are transmitted by needle stick injury. These are also viruses that are transmitted by needle stick injury. So important, there are three, hold like this, there are three important viruses that are transmitted by needle stick injury. What are the three important needle stick injury that are transmitted by? Hepatitis B, hepatitis C, and HIV. 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 The hepatitis B is preventable by vaccination. You have to take 3 doses and you are immunized for 5 years. You are immunized for 5 years. This vaccine is made up of hepatitis B, surface antigen. It's a DNA recombinant vaccine. It's a DNA recombinant vaccine. It is a DNA recombinant vaccine. So, what are the chances of transmission when you get needle stick injury? What are the chances of transmission when you get needle injury? Hepatitis B, 30%, hepatitis C, 3%, and 0.3%. So it is highly infectious. Hepatitis B is very infectious. Hepatitis B is very infectious compared to the hepatitis C. Hepatitis C, there is no vaccine. And there is no vaccine against HIV also. You remember the structure of HIV? Looks like a flower, enveloped virus. It is made up of antigen. This enveloped antigen is made up of glycoprotein 140 and glycoprotein 21, and it has got an inside capsid which is made up of antigen P24, and it has got two similar looking RNA pieces. And it has got an enzyme called reverse captase, and it has got one more covering. It is made up of antigen P18. P8. This is a structure of. This is asked in your examination most frequently. Now the diagram of HIV virus. And now coming to the DNA, again it's an envelope is made up of hepatitis B surface antigen. And inside you have envelope core, which is made up of hepatitis C antigen, and It has got DNA and it has got DNA polymerase enzyme. Polymerase enzyme. This is what a DNA polymerase enzyme. Whole of this structure is called as DNA particle. Whole of this structure is called as DNA particle. Whole of this structure is called as DNA particle. Now, coming to the RNA, HCV is RNA virus. They have to detect antibody against RNA virus. They detect antigen in the serum of the patient, antibody against RNA virus. So, now moving on to the laboratory diagnosis of all three needle-stick injuries: hepatitis B, HIV, and hepatitis C. Hepatitis C. So, as soon as somebody gets needle-stick injury, they should wash with water and they should immediately report to the infection control department. If source is HIV positive, antiretroviral drugs (ART) should be started within 72 hours, and both needle stick injury healthcare worker as well as the patient should be screened for hepatitis B, hepatitis C, and HIV. All of them has to be screened for hepatitis B, hepatitis C, and HIV. All of them have to be screened for hepatitis B, hepatitis C. Both patient and the person who got needle stick injury. Patient source. The patient is HIV positive, then you have to start antiretroviral drugs within 72 hours. Within 72 hours. You have to start antiretroviral drugs within 72 hours. If hepatitis B, you have to do the titer of antibodies. If titer is more than 10 IU per ml or more than 100 IU per deciliter, then there is no necessary to give any precaution against hepatitis B. If it is less than 10 IU per ml, then you have to start hepatitis B immunoglobulin on one side and other side you should start 3 doses of hepatitis B vaccine. On the other side, you have to start 3 doses of hepatitis B vaccine. Hepatitis C, you have to monitor every 6 months. Every 6 months, you should be screened for HCV status. HCV status. So for your information, we have got antiretroviral drugs in all the ICU, OT, and casualty, and all the where you come in contact with the needle stick. So because you are working on a patient, most of you, and you are the first contact, and there are chances that while doing the procedures, you may come in contact with the patient's needle sticks. So you should be very careful about these three viral diseases, blood-borne viruses: hepatitis B, hepatitis C, and hepatitis HIV. So it's very important that you should wear. So this is most time asked in your examination about needle stick injury, and you already know the how you dispose the biomedical waste. Very important. Biomedical waste management and hand washing, biomedical waste disposal, and precaution you should take against needle stick injury. Precaution should take against needle stick injuries. So you are already aware what are the colored bins that are used for disposal. Sharp edged needles are disposed in white colored puncture proof bin. Yellow colored, what to dispose? Uh, Anatomical waste. Infectious material waste. Red, red what? Remember parrot, red. Okay. All plastic material are disposed. Then blue glass vase. I told you how to remember. You're sleeping on a moonlit day, Purnima day, on a lying on the bed with a glass roof and seeing the blue sky. So you should dispose glass vase. And last one is black. Black one used for non-infectious waste, which is given for the corporation. Non-infectious waste, paper, food, or something like that, which is disposed. Non-infectious non-infectious waste. So, so remember some song like written about Chand, okay? Khoya khoya Chand, khula asman. Okay. Some Telugu song or some Tamil song written about blue sky and starry sky and नीले नीले अंबर पे चांद जब छा जाए. Okay, let's remember. White is sharp. White is sharp. Okay. Hindi there is. I used to tell them in uh, भेद छेद. भेद में छेद है. uh, सफेद में छेद है. White in Telugu what you call? Okay. छेद is sharp, edged. Yellow yellow dirty fellow. Okay. Infectious, all anatomical waste. Especially most common anatomical waste we dispose is placenta after the delivery. Placenta, appendix, thyroid, whatever operated part, biopsy material, all infectious material, urine, blood, sputum. Then parrot pee, parrot for plastic, parrot for plastic, parrot for plastic. Blue glassware, blue glassware. Black for non-infectious waste like food, paper, and other things to dispose of. So you should remember the long form of P, PEP and PPE. PEP stands for post-exposure prophylaxis. Post-exposure prophylaxis. Post-exposure prophylaxis. Following needle stick injury. Following needle stick injury. You get stuck with the needle. You should remember what you should do. And I just now I told you that it's a very tricky problem, because, and all of you should wear nice high-heeled shoes. Some people come to the college in bathroom chappals. Today I saw a medical students just got up. Morning I had a class between 8:15. Some people even not brushed, taken bath, and come to the class. And as a healthcare professional, you should try to be clean and neat, neatly shaven, well groomed, put some perfume, put some, if you're a man, put some aftershave lotion, girls, put some nice perfume. The smile gives extra 2 marks, in the examination. Even if you don't know, say, I don't know, sir. So that smile's charm. See, some of the students, they have a myth because they wore the apron and they passed anatomy. They say wear same apron in final year also. That will be stinking. Why you are wearing such a dirty apron? No, sir, I wore this and passed my anatomy. That's why I'm wearing the same thing. And a lot of students wear socks which they don't wash for months together. The moment they remove the shoes, no anesthesia is required. You just faint. So I had a clinic in Bangalore where I used to practice medicine, and I used to get a lot of medical representatives. They seen medical representative. They have a dress code. They will wear a tie and full shirt, and they have compulsory have to wear shoes. So in olden days, medical representatives were very one of the most important jobs. They used to give nice gifts, pens, pencils, keychains, and some. If you are a prolific nowadays, they are all stopped because of new rules by National Medical Council, and MCI has become National Medical Council, NMC now. In olden days, they used to give a very good gifts, including car, refrigerator, air conditioner, and all. Now it's all stopped now because of new NMC guidelines. We are not supposed to receive any kind of gifts. Anything like that. Now, representatives, I used to say them, remove your shoes and come inside my clinic. Some people used to remove the shoes and put on the socks and come. I told them, don't put on the socks and come. Your socks are stinking. So once I fainted because of socks smell. So you should wash. Otherwise, don't wear socks. Just wear shoes and come. It's better. So it happened with once Nizam of Hyderabad. It was from we are all in. You read the history and Nizam of Hyderabad. Hyderabad was ruled by Nizam, and he had a harem. I mean, he was a very rich person. So Nehru told him, "Don't wear socks and shoes and come inside. Remove everything and wash your leg and come inside." So Nizam, once he came, he was thinking. Nehru said, "Why you are wearing socks or shoes or something like that? Why you are singing so much?" "No, sir, I am not wearing them." "Where are your socks and shoes?" So he had kept his socks inside his pocket. "Sir, my socks are here." They are singing. So I'm not. This is this thing. It should be very clean and it should be presentable. There is something called bedside etiquettes. When you approach a patient, you should be smelling good. You should not. You should. A smile brings extra smile in the patient's face. They are already sick. They are suffering from agonizing pain. Lot of problems. When you come to the hospital like is a hospitality industry. It's like an hospital. You have to. Hospital should be a 5 star. Like when they come, they should feel good. Hospital air should be clean. Linen should be clean. Every day it should be washed. Every day they make bed. You must have seen them. Nurses doing bed every day. And the bathroom should smell good. Should be like a 5 star hotel. There is no difference between a 5 star hotel and a hospital. Instead of dining room, we have OT theater, operation theaters. The architect, once I met the architect, I was supposed to build a hospital for one, was taken as a consultant. An architect told me there is no difference between a 5 star hotel and a corporate hospital. They just have dining room instead of OT. That's the only difference. Now, high-end corporate hospital have come up with a lot of good facilities. Of course, every special rooms are fitted with air conditioners and all this. So this hospital waste is biomedical waste is very dangerous. It can spoil the whole environment. So you have to when you start your clinic or hospital, you have to take a certificate from pollution control board. You have to take a certificate from the country. Sometimes they outsource. We have outsourced our biomedical waste to some private company. They come and pick up every day. Must have seen the van. And some of the things we have to make a 6 feet deep pit. Inside you should bury all the infectious waste and cover with the bleach. You have to cover with the bleach. That's a very important source of infection. Hand washing was discovered by Ignaz Semmelweis. What he found was two sets of students coming out from one coming from the class, nurses coming from the class, and medical students coming out of the dissection hall. And in those days, puerperal sepsis, postpartum sepsis after delivery, was very high among the people coming from dissection hall. And he said them, wash your hand with soap and water, then do the procedure. He found that people who washed the hands and conducted delivery, the number of infections were very less. He got down. But everybody called him a fool, idiot. How can washing hands brings down the infection rate? And his work was not recognized. He spent a large part of his last time before death in mental asylum. This is a story of Ignaz Semmelweis. So hand washing technique, and all of you should carry a alcohol-based hand sanitizer. If you are seeing 20 patients, you have to wash your hands 40 times. And, one time before touching the patient, one time after finishing examination of the patient. Hand washing is a very important. It's the first step in the infection control in the hospital scenario. The biomedical waste very careful about the disposal of sharp-edged needles. Very careful about this. And needle stick injury, very important thing is you should be careful and you should always use When you are don't recap the used needle with double hand. Everybody, don't recap used needle with two hands. So you must have seen the syringes. I think you have used syringes after giving injection, and you want to recap. If you are seeing some pretty lady going there, turn that side and put that needle stick. It is very common. Okay. Uh, so put it on the table or some hard this thing. Then you put it like this, one hand locked like this. Once it goes inside the cap, press it. So that is single hand technique. Single hand technique. So anybody from dialysis here? Okay. So in Bangalore at least I've seen there is a designated dialyzing machine for HIV patient. They use separate machine for hepatitis B, HCV and HIV patient. They are not put on the same dialyzer which other patients are using. There is a separate dialyzing machine for the HIV patients. So and once you do dialysis, everything has to be decontaminated. That will be goes used for the other people use. That's very important. Now, laboratory diagnosis of HIV is done by enzyme linked immunocarbon assay, ELISA, enzyme linked immunosorbent assay, enzyme linked immunosorbent assay. Most commonly, the enzyme used is horseradish peroxidase. Horse horseradish peroxidase. Horseradish peroxidase. So we have a microtiter well. 96 wells are there. Each well one cross section I'll show you. There is direct ELISA, the indirect ELISA, and sandwich ELISA. Direct ELISA, indirect ELISA, and sandwich ELISA. So you know the definition of incubation period. What is the definition of incubation period? Definition of incubation period.
Sir, ఇది 125 papers ఏమేమి ఉంటాయి సార్ జెరాక్స్
Hmm?
125 papers
Print out.
total.
Back to back. It is you quote the what is, I was asking incubation period. What is the definition of incubation carry? Incubation period. What incubation period? So you remember as entry of organism and development of clinical signs and symptoms. Everybody, entry of organism and development of clinical signs and symptoms. Which infectious disease has got short incubation period? All respiratory, influenza, cold, COVID-19, short incubation period. Long incubation period, example of long incubation period. Yes, rabies. It goes via neurons. So to reach the brain, it gives rise to disease called hydrophobia. The moment bring you water in front of the patient, he goes convulsing. Don't kick the sleeping dog. To protect protects the dog will bite you. Most of the student, it happens. They'll be sleeping and you are going on a yama with your girlfriend, just kick like that. It will bite you. So very careful. Don't kick the sleeping dog. It's very dangerous. So put the antigen coated wells will come. Then put the antibody which is tagged with the enzyme HRP. Then you add substrate. There will be color change. This is positive. The indirect ELISA, put the antigen, put the antibody. So second antibody is nothing but anti-human gamma globulin tagged with HRP. Add the substrate, then there will be color change. This is indirect ELISA. So we have to capture the antigen, coat the antibody in microtiter well, and put the patient's serum supposed to contain antigen. Second antigen tagged with HRP, then add substrate, color change. Positive. So direct ELISA, indirect ELISA, sandwich ELISA. The antigen gets sandwiched between the two antibodies and with antibodies. So in HIV, we are looking for incubation period, entry of organism, and development of clinical signs and symptoms. It is called incubation period. Entry of organism, incubation period, entry of organism, and development of clinical signs and symptoms. Here in HIV, we say window period. What is window period? Anybody has got idea what is window period? Window period. So window period is defined as entry of virus and development of antibodies. Time interval between entry of organism, entry of virus. This is only in HIV they say entry of virus and development of antibodies. This is also called as seroconversion. 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 It's also called as seroconversion. It's also called as seroconversion. Entry of organism and development of clinical signs and symptoms. It is also called as seroconversion. It's also called as seroconversion. Okay, now moving on to the so hepatitis B, hepatitis markers are there. How many markers are there? 6. How many markers are there? 6 markers. Hepatitis B, surface antigen. Hepatitis B, surface antigen. Hepatitis B, C antigen. Hepatitis C, E antigen. These are antigens. Okay. Once they enter the body, they develop antibody. Antibody against surface antigen, antibodies against C antigen, antibody against E antigen. So there are 6 markers, and you can 7 marker you can detect the DNA virus, DNA copies by RT-PCR. RT-PCR. This C antigen, please remember, will not appear in the C antigen will not appear in the serum. If you want to see the C antigen, you have to do the liver biopsy and do what is called as FISH. FISH stands for fluorescent in situ hybridization. Fluorescent in situ hybridization. Fluorescent in situ hybridization. Fluorescent in situ hybridization. It's very important. Okay. Now you can write a graph like this. This is the months 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. This is antigen, antibody titer. At the end of 1 month, hepatitis B surface antigen appears. Hepatitis B surface antigen appears, and at the end of 4 to 5 months, antibody against surface antigen appears. At the end of second month, antibodies against antibodies, C antibodies. E antigen at second and half, E antigen appears, and antibodies against all these antigen antibodies can be detected by ELISA. All these antigen antibodies are detected against either coating antibodies onto the microtiter well or coating antigen onto the microtiter well. All these can be detected by the enzyme linked immunosorbent assay. Only C antigen will not appear in the blood serum. It will be present in hepatocyte. For that, if you want to see, you have to do what is called as FISH. FISH stands for fluorescent in situ hybridization. FISH stands for fluorescent in situ hybridization. Now moving on to the hepatitis C. We are looking for the antibodies. Antibodies against Hep C virus. Antibodies against the hepatitis C virus. Again, it is done by, instead of coating, you coat the antibody, then put the, again, you are looking for the antigen, coat the antigen, you are looking coat first and put the antibody, then you put second antibody, then HR, horseradish peroxidase. Color change shows the antibodies are present. Class, what you are taking in 11 o'clock? What? Salmonella part 2. Sure. Now, moving on to the, today there is no class for BPT. They have freshers days. Now you are here, here please remember, you are looking for the, again like HIV, you are looking for antibodies. Antibodies against hepatitis C antigen. Don't confuse with hepatitis C antigen in the hepatitis B marker. Okay. So markers you remember as SEC of hepatitis B. Surface antigen, E antigen, C antigen. SEC. Mnemonic SEC. Second SEC. Here you are looking for the antibodies. Antibody you have to coat the microtiter well with antigen. Put the antibody. Direct also you can do, but we always do anti-human globin. Second antibody, again specific to this antibody, we look for HRP and look for the color change, antibody surface. But what we do nowadays, commonly for there is something called cards, immunochromatographic card. These are called immunochromatographic card. Immunochromatographic card. This you must have seen in advertisement for pregnancy test. So woman goes inside and puts urine into the dot. There is one well here for putting the specimen, one positive control, one test control, one negative control. If two bands appear, it is positive. It detects the HCG, human choriogonadotrophic hormone. Human choriogonadotrophic hormone. So it's very important. Such kinds of cards are available for HIV, hepatitis B, HCV. Hepatitis B, it is called tridot. HIV 1, HIV 2. This is a test well. Okay. So if tridot appears, this is positive. It is positive. Tridot. Hepatitis B surface antigen we usually detect. There is a well to put the specimen, serum you put. There is a positive control. There is a test. If there two lines appear, it is positive. So in hepatitis C, the same thing. Immunochromatographic rate, put the serum, and one is test, another is control. Two lines appear, then it is positive. Then it is positive. It is called as positive. From whom all you do HIV testing? HIV testing. What calls for HIV testing? From whom you do HIV testing? Yes? Huh? What is the long form of HIV? Human immunodeficiency virus. It gives rise to AIDS. AIDS stands for okay. Syndrome. So nobody suffers from HIV virus infection. It attacks CD4 cells, helper T cells. Man become immunocompromised. CD4 count goes less than 200 cells. Then the first thing that appears is TB, tuberculosis, Candida, Cryptococcus, Strongyloides. So many other opportunistic infection comes. So, whom all you do HIV testing in hospital? Come on, I want some answer from you. What all you learned? HIV testing is called for what? Of course, once if anybody is suffering from tuberculosis, is screened for HIV. Okay, there is something called ICTC. You heard of this ICTC? What is ICTC? Integrated Counseling Testing Center. Integrated Counseling and Testing Center. In earlier days, it was called as mother to child transmission, mother to child transmission counseling center, MCTC. MCTC. Then all the mothers went to the court saying that why mother alone is responsible for transmission of infection, father also should be considered. So now all the people, both the couples, are tested for HIV. So what are the indications for HIV testing? One is that immunocompromised, a person is suffering from tuberculosis. So they're very important before testing. You should take the consent. Then you should counsel. Consent and counsel what is HIV and other things you should do it. And it is done in ICTC. The important HIV testing, it is done prevention of mother to child transmission. What are the infection transmitted from mother to child during the intrauterine life? Huh? You remember with mnemonics torch. Starch. S for syphilis caused by which organism? Treponema pallidum. Treponema pallidum. Why it is called Treponema pallidum? Tripose means curves. Tripose means don't think all curves are bad. Some curves are good. What are the curves which are good? No, I don't have it. Okay, it's all right. Now, now road curves are bad. Okay, so it's a curved organ. Do it like this. Treponema pallidum. It stains pale. So it infects the all systems of our body. If you know syphilis, you know medicine. Okay? Cardiovascular system, skin, genitals, brain, neurosystem. And finally, it dies of general paresis of insane, tertiary syphilis. प्यार में पागल हो गया, it's a nickname, syphilis. General paresis of GPI. Syphilis, Toxoplasma gondii, man get infected by eating food contaminated with feces of cats, cat born. O is mnemonic rubella. Rubella is called German measles. Congenital rubella syndrome, deafness, blindness, mental retardation. Rubella is general measles, German measles. Especially if occurs in first trimester, gives rise to valvular lesion, congenital valvular lesions, mitral incompetence, all those things. heart. There is one nursery rhymes you must have heard of. Ringa ringa roses, pocket full of roses, hushra pushra, all fell down. Even for chicken pox and generation. Very common. Then cytomegalovirus. You must have heard psychiatric term. You heard schizophrenia. What is schizophrenia? What is megalomania? What is your name? Bhanu Prakash. Okay. Suddenly, Bhanu Prakash thinks he is a god. He is Indra, Chandra, Devendra. He is king of, he is what, president of America. Suddenly, if I start feeling he's a very handsome, he's very good looking. All girls are behind him. And megalo means he thinks of himself great. Megalo, big. So schizophrenia is split mind. Is one of the psychiatric disorders. Okay. Very common among medical, dental, and allied health students. Very 1% of medical students suffer from schizophrenia. It's documented in all over this because of stress. Gets exposed to so many examinations, so many classes, so many practicals, so many hospital postings, and all those things. Life is a wonderful journey. You should enjoy. What is life? The full experience. What you go through in the life. Life is explained as it is the first BCG. On 0 day you take BCG, and one last ECG. When ECG like going there, you must have seen in movies, no? Tang, it becomes flat. Oh, everybody starts crying. Some people will be happy. I think मर गए साला अच्छा अच्छा हो गया. I served as a warden in MSM Medical College, Bangalore. So engineering college and medical college are next to each other. There always used to be a fight between engineering college and medical college students. Some engineering college student, a group of students were following me and they're talking to each other. It was a small group, earlier days, 79. Then just it passed, zipped around me. He said they started fighting. I said, nothing has gone wrong with me. Why you are fighting? He said, sir, we had 3 holidays. If you had died, another holiday would have gone for 1 week to our home. He missed the. He should have hit you, sir. That kind of students you get nowadays. That is a now rubella, cytomegalovirus, all cells become big. Hepatitis B, HIV, HCV, herpes simplex 2. These are all transmitted from mother to child during intrauterine life. Then there is TDDs. What is TDDs? Tirumala Tirupati Devasthanam. No. Transfusion transmitted diseases. Transfusion transmitted diseases. Transfusion transmitted diseases. Blood transfusion. What are the diseases? Again, syphilis, then HIV, hepatitis B, hepatitis C, malaria, cytomegalovirus. Cytomegalovirus. These are called TTDs, transfusion transmitted disease. Transmission transmitted disease. These are all called as transfusion transmitted diseases. These are called as transfusion transmitted diseases. So, absolute indication for HIV is number 1. Surgical procedure. Surgical procedure. Every person who is undergoing surgery has to undergo serovirology. They are tested for hepatitis B, hepatitis C, and HIV. Hepatitis B, HIV, and C. Okay. This absolute indication. Next is blood transfusion. Donors in blood bank are screened for donors in blood bank are screened for HIV, hepatitis B, and HCV. Donors in blood banks are screened for HIV, hepatitis B, and hepatitis C. Number 3, pregnancy. Pregnancy. Both husband and wife should be screened for HIV status. Both husband and wife should be screened for HIV status. But you cannot do HIV testing without the consent of the patient. You should remember 3 C's before testing HIV. What are the 3 C's before HIV testing? Consent. He has to write a consent form and you should tell him what he is tested for. What he is tested for. He should be told. And then counseling. He should be told what is HIV. He should be counseled. For example, if you are treating as a physician, you are treating one HIV patient, he is on ventilator. Now, HIV is not considered as uh, nobody should hang themselves because they got HIV. It is a treatable, completely treatable disease like hypertension, diabetes. You have got fantastic antiretroviral drugs, very good antiretroviral drugs. People are living with HIV. This was discovered in early 80s, 82, 83. And we got the first kit in Bangalore Medical College to test. We called all the doctors to undergo the test. Nobody came forward. It was like COVID in 80s. They were so scared. Some of the doctors stopped practicing medicine because of scare of HIV. There were so many picture. Even COVID, when we got a first wave, everybody was taken and put in one this thing barrier, this thing for PPE. Everybody used to look like a devil with PPE and all those things. Nobody even came forward to the hospital thinking that they will be isolated, put behind bars. Even dead bodies are not given to the relatives. And it was such a havoc. For 2 years, so many people lost their land, so many people lost their jobs, so many people suffered so much. Now we are recovering. It was very nice to have a fresher party and it was very well conducted. You dance very well and all those things. It was very fun. So life is Kushi Dev. As long as you are there, it is distribute happiness among people. Okay, doctors are humane. Okay? They also got heart. So you have to distribute happiness, and you treat the sick. And when he says, "I have become all right, doctor," and you feel happy. More than money, what he gives, the happiness you get by treating a patient. If, if I bring happiness or smile in you by teaching something which is knowledge is empowerment. Only knowledge cannot be stolen. If you have a wealth, if you have a land, if you have a gold, if you have a diamond, can be stolen. Anybody can steal anything. But knowledge, when it is impregnated here, knowledge is empowerment. Nobody can steal what is written in your grey matter. It's a wealth, enormous amount of wealth. Education is a wealth. Invest in education. You want to read higher and higher and higher and higher. You want to achieve so many things in your life. At 67, still I read every day the recent articles in Lancet, all leading journals. So it's very important. Knowledge is empowerment. Okay. These are absolute indication. 3 C's. One is consent. Consent. Next is confidentiality of the report. You should not come out and OPD. There are some 15 people are waiting there in your OPD. Oh, you are tested HIV positive. Oh, where did you go? Where did you sleep? With what movement? You should not reveal the HIV status. If he says, don't reveal it to my wife and relatives, do not reveal it. Okay? So a 24-year-old boy gets admitted into the hospital and his HIV status revealed to all the relatives. His mama, chacha, kaka, bhanja, everybody came, started scolding him left and right. You are a very bad man. And before marriage, why did you go there? And why you had a sex? And the boy committed suicide. Who should be blamed for this? Who should be blamed for this? What is your say? Who should be blamed? So please remember, don't reveal HIV status without the consent of the patient. Only treating doctor should know his HIV status. So confidentiality is very important. This happened with COVID also. We had got more negative report from outside than positive report done inside. Every day when student used to go for holiday, they used to come with nice report. COVID negative, he can be admitted, can restart his schooling and all that. We had more number of negative report than positive report, which we distort in our RT-PCR lab. We have RT-PCR lab. We have seen. Okay. Now this happened in COVID also. This happened in 80s HIV also. But HIV is one stigma is there. HIV is a sexually transmitted disease. Even if you get by needle stick injury, even if you get by blood transfusion, even if you get by some other source also, the stigma is there. Oh, maja kiya hoga, and you got this. All those things. That stigma is there. That's very bad. COVID, that stigma is not there. Only barrier of isolation, putting in some corner and getting treated, and nobody come and see you because unless they wear PP, personal protective equipment, that is there. That's very important. Pregnancy, pre-surgical procedure, pregnancy. Then fourth is dialysis. Patient undergoing dialysis, and sometimes some of the corporate hospitals pre-employment policy. Pre-employment policy also they test for HIV, HPV. Some people may refuse. They do not give consent to give HIV testing. It all depends on the corporate policy what they want to do. And here before employment we are tested for HIV. Before getting a job here, we are tested for HIV, HPV, and HCV. Then even if you want to go to US or foreign countries, you are tested for HIV status, tuberculosis, and immunization against chicken pox and so many hepatitis B, BCG, for tuberculosis, and all those things. So, for example, if you're, what's your name? Huh? Farhan Akhtar. No, not Akhtar. Farhan what? Akhtar only. Farhan what full? Okay. Farhan, you are a treating physician and somebody comes with a glossy wedding card. Says, I'm getting married next week. What is your advice? You are treating him antiretroviral drug for last 5 6 years. You are treating him. He's all right. Now he comes says that I'm getting married next week. So and so. They are giving so much of dowry and all that. I want girl is beautiful. I want to marry. What do you say? Huh? The tagline for HIV is sex is don't condemn the sex, condom it. Rubber is the only answer at present because Bill Gates and Melinda Bill Gates have uh, poured tons and tons of money for the research and getting vaccine for HIV. because so many antigens 120, 180, 141, 24, 18, 55, 66, the RNA, RNA, so many enzyme antigens are there. And this virus undergoes mutation frequently. You don't have vaccine against HIV, unlike hepatitis B. So you should allow him to marry, but tell him that what is HIV and all those things. That's very important. That's very important. Okay, now any other indication do you think? Some people say before marriage. No, it's not allowed. It's because some of the brides went to the High Court in Gujarat and Maharashtra. But all boys, vice versa, girls should produce HIV status before marriage. It was turned down. India is a democratic country. Mera desh mahan. And don't condemn the sex, condemn it. Premarital, no. No testing is done. Okay. That's why you should marry somebody whom you know better. Now everything has come in now, live-in relationship. Marriage, slowly institution going to be dilute, outcast. So you live together for some time. What happens if you, what is gay? You know what is gay? Why you are so shy? You are all healthcare workers, medical students and all those things. Gay and lesbian. You heard the long form of LGBT? Some seats are reserved in the constituency for in Lok Sabha and legislators. Lesbian, gay, transgender, bisexual. Gays means men having sex with men, and lesbian, woman having sex with woman. Transgender is hijida, transgender, and bisexual, they can have sex with both men and vice versa. So this is a community called LGBT. Okay? Nothing wrong in that because must have seen movies like Karan Johar's movies where all the gayism is glorified nowadays in every movie. Dostana, you must have seen Dostana movie where Amitabh Bachchan's son, what is his name? Huh? Amitabh Bachchan's son, Abhishek Bachchan. Okay, he is Aishwarya Rai's husband. Yeah. He plays a role of gay, not role of a gay, but they act like a gay. Actually, they are not gays. So most of them are. No premarital. No. Any other doubts about HIV testing? Whom all shouldn't do HIV testing? One is that immunocompromised, they suffer from candidiasis and sudden loss of weight, more than 10 kgs. It occurs in diabetes and HIV. Any other? Huh? Any other? Huh? What? Tuberculosis over now. Tuberculosis in diabetes and hypertension, HIV. They have to treat in, we have started what is called ART center, antiretroviral center. We have ICTT center, ICTC, Integrated Counseling and Testing Center. Any questions about, does kissing transmits HIV from person to person? Kissing without? No, and they have tested. Even if you drink 1 gallon of saliva from HIV infected patient, 1 gallon will not suffer from HIV. Kissing you are allowed. Handshaking, using towel is allowed. Nothing will happen. Sharing a room, sharing a towels and all this. Food. Don't consider HIV positive status outcast. Now, employment also HIV positive status. If you deny employment or treatment for HIV patient, he will sue you in the court. No, you cannot deny HIV. Even leprosy also. It's a treatable, fully treatable disease, and it's very important. Go and have a cup of coffee and come back. Thank you.